So considering the NHS dispute and considering Keir Starmer's horrendous position towards future NHS policy, and also obviously the Conservatives' position towards NHS policy, both of the major political parties in this country have hilariously poor policies towards trying to fix the NHS. There has actually been a debate on Channel 4 News. Medics and politicians debate the issues in the NHS. Now, Wes Streeting is in this debate, and considering he's literally gone to a public war with members of the medical profession, basically both of the mainstream parties have decided they absolutely despise the NHS and all the staff that work there, which is, it is great. I'm glad living in an incredibly vibrant multi-party democracy with loads of different points of view being represented. I'm absolutely relishing the ability for Wes Streeting to get told how much of an arsehole he is by members of the medical profession. So we're going to watch this and we're going to see how it goes, and hopefully I'll actually have a segment to upload from this stream today.
So let's start with the strikes. We've got a remarkable audience of experts, people who were involved in these strikes. Rhiannon Wheater. Now, the strikes weren't actually on in Leeds today because they're divided around the country, but you have been on strike before. What do you want to say to Helen Whately there in the studio in London?
I want to say that I've been an NHS nurse for 24 years, and I've never seen the NHS in the crisis that it is in right now. We've got 48,000 nursing vacancies. Our wards are unsafe. We are shouting and telling you that our patients are not safe. The government are not stepping in and doing anything about it. You're talking about strike days being safe for staff. What about...
Yeah, I'm always impressed by Krishnan Gurumurthy's journalism. It feels like literally the only place in the country you ever get anything approaching reasonable journalism is either Scotland or Channel 4.
Non-strike days. What about non-strike days when we can't safely look after our patients? What about those days? When are the government going to step in? We need a restorative pay rise. We need to bring those nurses back into the NHS to safely care for our patients. When are the government going to come to talks with the Royal College of Nursing?
Helen Whately?
Well, as Rhiannon just said, we know that it's really, really hard in hospitals at the moment across the NHS and across social care. And we are doing what we can to help. We have been working on this over the years that we've just gone through. So, for instance, since 2010, there are now 44,000 more nurses in the NHS and 34,000 more doctors. But
that doesn't take into account the levels of attrition. Every single time, the same lines, the same damn lies and damn statistics. Oh God, I'm sick of debunking the same points over and over and over again, because it's clear, and they've all been fed the same shit by the spin doctors. They all understand that none of this is just in any way representative, because they've been told, essentially, they know how to lie with facts. And the wise words of Jeff Hoagland, the facts never lie, but people lie with facts all the times.
I know it still feels like it isn't enough, and you mentioned vacancies as well. We know part of the situation right now is something that's going on across Europe with a lot of people with flu, the worst flu season of the decade.
And the failure of social care is the root of a huge amount of cause with the problems in the NHS. First of all, because there's not enough spaces in social care to be able to discharge patients from the NHS, which is filling up beds in the NHS, which is increasing waiting times. So that's a really huge problem. Second of all, obviously, we saw people discharged into care homes who were testing positive for the coronavirus, which caused huge amounts of deaths of people in care homes. So, the massive failure of the Conservative Party to tackle social care is a huge problem. And of course, we had an opposition party who was offering a national care service at the last election in 2019. So, the public indeed, as always, got exactly what it wanted, because of course, Corbyn was right.
Decades, and of course the pandemic we've just come through. We're trying to help in the short term, particularly putting extra funding into social care to help people who don't need to be in hospital to be discharged, to help free up hospital beds for those who really need them. We're also investing in more staff for the NHS, training more doctors, training more nurses to make it better in the future, and looking ahead at how we provide care differently, how, for instance, we can care for more people out of hospital and joining up health and social care so the services work better, make it better for staff, and of course make it better for patients.
Do you want to come back here?
Yeah.
I remember talking with Kevin Logan on the channel, talking about how the Conservatives are really great at winning elections and terrible at governing, because they don't think they care. They understand the ability to be able to say policy that be able to bring people over from other disciplines, right? to bring members of the public over on their actual their kind of grandiose policy platform, but they don't have any clue how to actually fucking govern, right? The issue with social care has been a massive problem for ages. That's why, for example, Jeremy Corbyn promised a national care service in the 2019 manifesto, because he knew that it was going to be a problem moving forward, right? These problems have been there. The problems have been manifesting for years and years and years, and we have the same Conservative Party who are too late to notice these problems whenever they actually arise. They don't have proper solutions because they're too properly enamoured with free market ideology. And from there, these problems will then arise, and they'll try and then fix them post hoc, rather than dealing with the problems before they actually come to the levels of horrendous provision that we're getting at the moment. We need to give the social care budget to the NHS and truly unify care under the ICBs. Absolutely, 100%.
So COVID and flu haven't caused this crisis. This crisis was there before COVID and before flu, before any kind of pandemics or epidemics. This has not been caused by COVID or anything else. You talk about having beds to move our patients into adult social care. Last week there were 14,000 patients in an NHS bed with no reason to reside. That means they had no medical reason to be cared for by NHS. You're talking about purchasing beds in the social care sector. There's no staff out there either. Who's going to staff these beds? It's exactly the same question. Is who's going to staff social care beds as who is going to come and protect our patients in the NHS?
Let me also just bring in Maxine Wade, who's also a nurse. What do you want to add to that?
Steve Barclay and your government need to engage with talks with the Royal College of Nursing, because it's insulting that the onus is put on us to do this. The fact that we have even had to go on strike in the first place after everything that we've gone through as a profession over the last few years, and then to be disrespected of lies by ministers such as Nadine Zahawi lying about pay, saying that pay starts at £31,000 a year for a band 5 staff nurse. It doesn't, and that's just another example of further demoralisation of the workforce. I don't think this government appreciates how burnt out and...
Yeah, and I've said it before and I'll say it again. Steve Barclay going to the union talks, telling Unite and telling the RCN and telling Unison that they were expecting productivity increases off the back of these people doing hugely tiring and gigantic shifts to cover the staff shortfall that we have at the NHS at the moment, expecting them to increase productivity even further. The absolute fucking cheek of it.
Demoralised nursing staff are in this country, and how utterly fed up, because we can't do our jobs. We're working 12.5-hour shifts, we're often not getting our breaks, we're dealing with large workloads of patients, and it's just simply not safe, and it just feels like your government is completely tone deaf and not listening.
Helen Whiteley.
I mean, absolutely, we are listening, and I hear you on how hard it is. I talk to staff in healthcare and in social care all the time, and have done for years, and know how hard it's been in the past, but particularly now. I come from a family of doctors and nurses. I use the NHS of myself and my family.
My dad was also a tool maker.
So, and of course, with constituents who, all of us use the NHS. So I know on all those dimensions how hard it is. On the point on pay, now we have, and you'll have heard this, but I think it's still really important to say that we have a pay review process which is independent of government to work out what is a fair...
Independent of government, yet appointed by the government.
...level of pay, recognising, of course, that we must reward staff, and of course the nursing unions and others...
How is it fair pay if it's down 19% from 13 years ago? Like, none of these claims stack up, and you can repeat them ad infinitum and people aren't going to keep believing it. And the fact that support for the nurses' strikes are still as high as they were at the start just shows that the government's lines on this don't cut the mustard and aren't actually cutting through on an optical basis. See, the Labour council said something like, "My granddad was the son of a miner," in a campaign video. I mean, it's just, the politicians in this country are just like the absolute bottom of the barrel. It's terrible. Imagine if you went to a job interview and said, "My dad was a carpenter, so obviously I can make a cabinet." Yeah, exactly.
Staff unions feed into that process, but of course we need to have a level of pay that the country can afford, and government has to be responsible on that. And what I'd say in particular to the nursing unions is negotiate and take part in that pay review process so we can get this right for the years ahead. Make sure staff are rewarded the right way in pay, but also we need to do all the other things that make the NHS a better place to work.
Just
That's
to keep
recruiting, retaining, bringing in more staff, and looking at all the things that make hospitals and other places better places.
Just to keep everything factual, we have to put that caveat when you talk about an independent pay review body. It's a pay review body that you set the terms of reference for, and you define what the parameters are that they have to answer. We're streeting. I know you say that the government should be negotiating. Should they be paying the nurses more? Should they be upping the offer?
I can't see a way of breaking the deadlock, frankly, without it. But the crucial thing is...
No one, yourself and no one from your party will say exactly how much they want to get paid, or even give a ballpark figure of how much it should be. You just say, we will do a negotiation. And as I've said 1,000 times again, you're not going to be in power. There's not going to be an election for another 2 years. You can literally commit to any number at all right now to back the nurses explicitly, which again, as I've mentioned before, is the optically best thing to do. Everyone in the country loves nurses. They're the most trusted profession in the country. Every poll will tell you as such. So to not come out and just say, yeah, we'd give them an inflationary pay rise, 11%, bish, bash, bosh, there you go, which, to be fair, isn't enough. They need to not only have enough pay rise to keep the current keep the current staff, but to recruit new staff to ensure the current staff don't lead due to overworking, right? They need to be giving a bigger pay rise. And I've said previously on this channel and on Twitter that I do not think the RCN should compromise at all on 19%. It should be 19% or bust, quite frankly, as far as I'm concerned, because this is not just about the pay of the existing staff. It's also about the ability to retain the current staff and also to recruit new staff. And that's not going to be helped by inflation-level pay offers, which don't really actually fix the retention problem, which is not just downwind of pay, but also of conditions too, and not working contractual conditions, but the amount of work they're expected to do and the time frame they're expected to do it in, and also work.
Helen says she's out talking to nurses. The most important person that she could speak to right now is Pat Cullen of the Royal College of Nursing, who before Christmas said if the government was prepared to sit down and negotiate on pay, not settle, just to start negotiations, she would have suspended the strike action then and the members would have supported it. She then came back in the new year and said, all right, meet us halfway, and the government still refuses to negotiate. And so, in the end, you have to look at this, and I think this is reflected in the polling. The nurses could not have been more reasonable about this and the way they've approached the negotiations. The government couldn't have been more unreasonable. And I don't expect Helen to sit here this evening and say, OK, well, we'd settle on X% instead. I don't expect that of her this evening. But I do expect her boss, the Health Secretary, to be in negotiations. And I do expect the Prime Minister to step in now, because if I were the Health Secretary and we'd had the first national nursing strike in the history of the NHS, and now the biggest strike in the history of the NHS full stop planned next month, I would be hauled into Downing Street to see Keir Starmer to explain why I failed, and he would be telling me to get round the table to negotiate. And that's what a Labour government would do.
You're saying up the offer, that means more money, either to take it from somewhere else in the health budget or to go to the Chancellor to ask for more money.
Pay terms and conditions, because the pay review body...
But where does the money come from? Does it come from the health budget, or does the Chancellor need to stump up more money from somewhere?
Look, I think it's not for me.
How about the money comes from the central bank, which is where all of the money comes from, because the government and the central bank are the currency issuer. That is, have you ever heard this concept called fiscal expansion?
Me to solve the Conservatives' problems, but I would just say this. The danger and the risk for the NHS now on this issue of pay isn't that nurses walk out for another day or another 2 days or another 4 days, it's that they walk out altogether. We don't have enough nurses in the NHS, we don't have enough doctors in the NHS, we've got midwives leaving the profession faster than we can recruit them in many cases, and we've got countries like...
And also, even with the pay rise of the nurses, the fact that you'd increase recruitment would then reduce agency staff, and the agency staff are more expensive than what the nursing staff would be with the actual proper pay rise. So, in fact, in a lot of the senses, the pay rise that you could theoretically give the nurses would actually pay for itself in the long run regardless.
Australia and Canada, who are actively recruiting our staff here to go overseas, and
you then wouldn't have to beg the central bank for additional quantitative easing.
That's the risk, and that's what Jeremy Hunt has to factor in as a former health secretary who now sits in the Treasury.
Any other nurses here who want to come in? Yes, Millie May.
Shouldn't we be funding studies to support our future healthcare students? The only maths this government needs to be working out is how to increase the amount of nursing students across the UK.
Helen Whately.
Well, yeah, absolutely right. I mean, we are increasing the number of students studying nursing, and also other routes into nursing, like through apprenticeships. And that's one way where we're getting to have 50,000 more nurses by the end of this Parliament. So increasing those numbers. But I mean, I think
she's the Junior Secretary of State for Social Care.
Important point, and just picking up on what Wes was just saying a moment ago, and Chris just questioned him, is it's all very well saying there should be more pay, but you've got to have an answer for where the money comes from.
The central bank. We are a currency issuer. Learn how economics works.
Otherwise, it's just an empty, unfunded promise.
Right, Helen, I'll just say respectfully, I'm not taking lectures on where the money comes from a government that has literally sent billions of pounds of taxpayers' money up in smoke through unusable PPE, that's wasted billions in crony contracts to Conservative friends and donors. If you want to know where the money is, look there and stop telling people who've got us through this pandemic that they should pay the price, while other people, friends of your party, have absolutely raked it in during the pandemic. You know, you're now threatening to sack these people for failing to provide minimum standards on strike days. Can we sack you, or the Health Secretary, or the Prime Minister for failing to meet any national standards on non-strike days?
Stop saying things I agree with, Wesley. No, bad Wes. I'm supposed to disagree with you.
What's your answer?
Well, I think a lot of what you just said there, Wes, is really misleading, and I'll come back on it, but I don't want us to go necessarily backwards and forwards, but I know there's a whole audience in the room with lots and lots of experience. But no, the fact is, anyone...
Of course she's a fucking management consultant. Like, whenever I talk about bullshit jobs, my first point of call is saying that people are management consultants. Because I've always... I love... Like, unironically, this person is a management consultant. It just shows you that when people get given cabinet positions, whether they're in the main cabinet or whether they're in junior members of the cabinet, none of them have anything close to the expertise in those fields regardless.
In government during the pandemic would have done their utmost to, for instance, make sure there was PPE, make sure there was testing, make sure that we brought forward the vaccination scheme that we did to get us through the pandemic. So it was right to do everything we could to get us through the pandemic. Now
Matthew Taylor, let me bring you in.
And I know that you actually said you support the independent peer review body process as well.
Matthew Taylor, from the NHS...
at least she's correct in that Wes Streeting is basically a charlatan because he's trying to castigate the government for doing bad things when he is, as she is correctly saying, has said that he believes in the pay review body process in this particular instance, which is why the pay offer isn't good enough.
NHS Confederation, this is exactly what you've been warning about. We've now got entrenched positions. Nobody's talking to anybody. Where's this getting us?
So I think the first thing to recognise is if there were no trade unions and there was no industrial action, we would still have a crisis in terms of recruitment and retention and motivation of staff. We have 130,000 vacancies, and the fundamental problem with our service is a lack of capacity, and workforce is the major part of that lack of capacity. So the trade unions could cease to exist tomorrow. The government would still have to answer the question of how can we recruit and retain and motivate our staff. Now, in terms of the industrial action, winter is a very tough time for the health service. We have the twin-demic of flu and COVID. It looks as though they may have peaked, which is the one bit of good news. But this is a terrible time to be having strike action. The trade unions have absolutely lived up to their commitment to protect life and limb. And that means that we've got through these days reasonably well, because we planned for them and with the trade unions cooperating. But the problem is this. We're trying to deal with demand at hospitals, GPs, and throughout the system, but we're at the same time trying to deal with the backlog. There are millions of people on waiting lists, the fact that we're not carrying out health checks like the way that we did in the past. So the problem is that leads to more illness in the community, which drives more demand. So the leaders I represent have got to deal with that demand issue and at the same time to try to recover the health service so we can get out of this crisis. That's an incredibly hard thing to do. If you then add in industrial action, a kind of war of attrition, which it seems to have turned into now, going on and on and on, then that incredibly hard task becomes almost impossible. Thank you very much.
So what is the state of treatment in the National Health Service if you have an emergency? Let's try and follow the journey through an emergency with our guests here in Leeds, starting with ringing 999. Now, Michelle Ravenscroft, you're a paramedic.
I am.
What's your experience when people ring 999, and of you trying to care for them?
The delays are absolutely phenomenal. We've gone from...
Also, Dan PGM in YouTube chat. Labour won't hammer home the fact that UK is a currency issue because Labour are monetarists and don't fundamentally believe in using the central bank to be able to increase the money supply. That's all it is, right? We have neoliberal people in charge of the supposedly progressive party, and they also kind of, I mean, they know that if they talk about that kind of thing in the public sphere, the media will crucify them for it. So even if they don't believe it, which they obviously do regardless, they wouldn't actually be allowed to say it without being destroyed in the quote-unquote marketplace of ideas.
A standard response time of 18 minutes in life-threatening situations of heart attacks and strokes to the national average being reported as being an hour and a half.
So what's that like for you when you're trying to save somebody's life?
Isn't YouTube chat quiet?
It's terrible. The first thing you walk into is people who are obviously very, very upset. You're apologising before you can treat someone. And the longer that they're left in them life-threatening situations, the worse condition they're in.
Do you feel those lives slipping away?
Absolutely. We are seeing people in the community die because of delays.
Right. So you take them to A&E.
Yes.
Let's talk to Don McKechnie, who's an A&E consultant. What happens when they get to you?
Well, it's a matter of them eventually getting into the department. As we've heard, there are waits outside the department before the patients can get in, because departments are full to bursting. Departments are finite size. I've discovered areas of departments that have never been used for patient care before. Storerooms. We're back to corridor care medicine. We thought we got rid of that years ago. But it's essential these days to be able to look after patients.
What does that mean? What do you mean corridor care?
Well, patients cannot be put in a cubicle, so there's no privacy and dignity. The whole care process is managed on the corridor. So
have you ever seen anything like this in your career?
I've been doing this a long time, and there have been phases when it has been bad. Before the 4-hour target came in the early 2000s, patients waited a long time, but not as bad as it is now.
And what was the answer at that time?
And not a great number. Well, the answer was to try and bring in some standards to try and get patients moved through the system. And we managed to achieve that because a lot of the problems there were actually in the departments themselves. They were at the front door. Currently, the problems are not at the front door of the hospital. The problems are within the hospitals themselves, and the fact we cannot get patients out of the hospital to create the space for the new patients coming through the system.
Right, well, what's it like to be a patient? Susan Bailey.
It's incredibly frustrating to think that, you know, Labour did really good things with NHS during the 2000s, just at the expense of gigantic fucking piles of PFI debt. At this coming new, as the years have gone on, paying huge amounts back, which has continually not bankrupted, but clearly hampered the ability to be able to fund it in the future, which is, again, an incredibly, as I've mentioned in my YouTube comments previously, a very cynical house of cards that, as it collapsed, got dumped onto future generations, which is very cynical from the new Labour government. They must have realised that it was the house of cards had to collapse eventually as well. They must have known that it would have done, because they were cynically employing it to buy votes then at the expense of votes later.
Your husband was a patient.
My husband was a patient. He was taken into hospital at the end of last month at about 11:45. So he lay in a corridor for several minutes. He was triaged, I think they call it. Then he was taken through into...
Well, exactly, we could have done, right? But the issue is that Tony Blair, one of Tony Blair's kind of founding principles of New Labour was essentially agreeing to the same kind of monetarist fiscal discipline that Thatcherism adhered to. Hence, Peter Mandelson saying, "We are all Thatcherites now," very famously in 2004. So they actually couldn't engage in fiscal expansion based upon their own rules about what should and shouldn't be, what shouldn't be justified as fiscal expansionary policy. I mean, even John McDonnell, his shadow chancellor, creating the Labour manifesto in 2019, when he was speaking to the Office of Budget Responsibility, one of his red lines was only ever using this kind of stuff for investment into future infrastructure, which is not the same as new paying nurses more, so that even he wouldn't have done explicit fiscal expansion to try and increase nurses' pay. But you're absolutely right, Bilderberg, that we can and should have tried to use that money to be able to pour it into the NHS without using PFIs and adding on to individual sector debt, which then got compounded by Lansley reforms. If they privatised the fiscal expansion, basically, whilst creating the partnerships that privatised the NHS as an institution by stealth. So yeah, isn't New Labour great? Love it. And everyone talks about how great it was, when really it was only really great for the certain sectors that got PFI contracts for those years before Labour quit and the repayment started, all for people who managed to get their second property. Like, it wasn't the absolute kind of abundant utopia that everyone tries to claim that it was, which boomers keep telling you because they lived through the good years rather than the bad years.
He was given a cubicle, half a cubicle. When I walked around to see what was happening, the place looked like a military field hospital. There were beds all over the place, beds on the corridors, very, very few staff. It was absolutely awful. Then he had a blood test, and then at 10 o'clock the next morning, having been suspected with cellulitis, 10 o'clock the next morning, a doctor managed to get to him and prescribe some things. The prescription...
12-hour wait, then?
Oh, a 10-hour wait.
10-hour wait.
And then another 2 hours for the medicine to arrive before he had anything,
And how is he now?
Well, he's got over the cellulitis, but one of the difficulties for me was that he has vascular dementia, which was exacerbated by the very high temperature and the long wait that he had there.
Right. Well, a lot of these waits are to do with finding beds, aren't they? So, Chris Gale, you're a hospital doctor, cardiologist. What's the problem?
The problem here is that we can't discharge patients efficiently back to their appropriate place to stay.
there's a gridlock here. So patients need to be assessed in some circumstances and appropriate interventions put in place so they can be safe at home. I just want to come back to the heart attack, the example, and talk about a heart attack, because it's a medical emergency. It's a really crucial area because we have the treatments, the technologies to be able to deal with that really effectively and save lives. When patients phone 999 because they have chest pain and spend an hour and a half waiting to come into hospital, the prognosis is much worse. If they survive, patients will go on to have further heart attacks, heart failure, stroke or other illnesses. They then present to a heart failure clinic in a much later stage of disease, which is arguably harder to treat.
So when the government rejects those claims of how many people are dying because of this current crisis, you believe
I would challenge and say that there are excess number of deaths associated with delays to care.
OK. James Wilkinson, you're a patient who wouldn't put up with this wait. What did you do?
I went private. I had private healthcare, but I would have got paid out a lump sum for being in an NHS hospital, being self-employed. I couldn't afford the time off work. So I got cancelled 5 times altogether. And after that, I spoke to my surgeon and asked me to do it privately. And got me done 10 days later.
Helen Whiteley, are you not ashamed listening to that? I mean, did you think anybody in the government owes the British people an apology?
Well, so I've been listening hard, and it's hard to hear the stories that we're hearing this evening and many other conversations I've had about how it is at the moment for patients and their experiences of care and for staff working in those environments. And yes, it is really hard.
And I've not seen that story, Jim, speak, but it seems to me like this is probably an isolated incident rather than something endemic, but I could be wrong.
As we know, all the extra healthcare need, more people coming to A&E, more people coming to see their GPs. The people are coming, I'm told all the time, are often sicker, needing more care. So that's putting so much pressure on our system. And then, of course, the thing for us to do in government and with the NHS leadership is, well, what can we do about this to make things better? So we are doing things. So right here and now, putting extra money into social care to help with the discharges from hospital. And the members of your audience there have been really...
to be fair, most people have used the NHS because if you have anything serious that's expensive or if you have emergency care, there's nowhere else to go because the private sector has no provision for any of this because they won't do something that's not profitable. And emergency care or expensive care is very much not profitable unless the waiting list for the NHS is so long people are willing to pay the huge amount that it would get them to the position where owning and operating and paying for the operation of the equipment that is required for such complicated medical intervention would therefore be profitable for them to do in the first place. So most people, the vast majority of people, even most Tories who have private healthcare contracts or independent healthcare payments, as Rishi Sunak would put it, they've still all used the NHS because they will have gone to A&E, which is purely run by the NHS in this country.
Really expert in describing some of the problems and how they run all the way through from ambulances, through A&E, through the hospitals, and all the way into getting people out of hospital again, which we know once you've been declared fit to go home, out of hospital is better for you. So put 700 million in to help with that process and help increase the capacity and improve the assessments and get people out of hospital. An extra 50 million just very recently to increase the space in some EDs, emergency departments, where being really cramped conditions can make it harder to work. And then we're working really hard looking further ahead, trying to make sure that we get better through the summer and for next winter to increase the capacity across the system, but also to change the way that the health and social care system work together and particularly to care for more people out of hospital.
Anne O'Mahony, you're from the Care Association, you provide care. When the government says it's putting money into care to solve this problem, what does that sound like to you?
That's not correct. Social care is not receiving money at the moment. It's very, very tough out there. There are empty beds for people to come out of hospital into social care, but there are no staff out there to help us to bring those people out of hospital because we simply do not have the money to invest in having those people trained and ready to go.
Next to you is a care provider, Jagjit Singh.
Jagjit Singh, yeah. So basically what we have to consider is, if you ask CQC the number of care homes that have deregistered from nursing and become residential. So there's an expertise that used to exist in social care, which is radically...
It's just funny looking at the information that's being given here. Granted, lots of this is new information for me. I'm willing to believe wholeheartedly that even the Secretary of State for this stuff is literally listening in right now. Secretary of State for social care almost probably is completely unaware of what's happening here and or the operation of the sector that she's supposed to be the Secretary of State for. It was very clear that she doesn't understand because she just continually gives platitudes that don't actually meaningfully address the questions and or points that she's being questioned upon.
Reduced. So you've got a combination of the government taking $2 billion out of social care during austerity, and then following on from that, we've had Brexit, and then we've had COVID, and so you've got a social.
What's Brexit got to do with it?
Well, the workforce crisis and various other things. There's many factors that Brexit is involved in this, and therefore you've got a system which is on its knees. And now you're saying to us, yeah, we'll throw a bit of money at you, but to come and help us, but they don't have the workforce, they don't have the capacity, and they don't have the expertise because. Just in my area of Wakefield, we used to have about probably 20 nursing homes, and now we've probably got 6 of which are one of the ones that few that exist now.
Right.
And so if you don't have that nursing expertise in social care, they're the beds that the hospital needs to empty in terms of having that to go into community.
West Streeting, how would you solve this?
So I think we're beyond sticking plasters. We have to get to the root cause of some of these issues. And I think in both social care and the NHS, actually, workforce and lack of workforce planning is a serious problem. The government announced £500 million worth of funding back in September, a lot of which still hasn't reached the front line. Unless that's directed to providing better pay and terms and conditions for care workers, we're going to continue to see people leaving social care to go and work for the likes of Amazon, who, with respect to Amazon, last time I checked, weren't famous for their pay terms and conditions. Similarly, in the NHS, we've got to deal with retention and the fact so many people are leaving, but we've also got to deliver on recruitment, which is why we committed to the biggest expansion of NHS staff in history, doubling the number of medical school places.
The problem is you can't just say we're opening school places, we're committing to expanding new staff training or whatever without properly actually giving the incentive people to want to work there, which is going to involve a pretty substantial pay rise, which, as I said, should be the 19% that these people are asking for to ensure that we actually get up to that point. You're right, Ace of Skate. Thanks for joining the chat. Welcome. Like, unless you properly say how much you're willing to pay these people and how you're going to use that to drive the recruitment, you can have as many additional spaces as you want. If people don't want to actually get into those spaces and join the medical staff, which they won't do if people are continually overworked and underpaid, you're not going to be able to do the recruitment that you're promising that you're going to do. You're living in a fantasy world, right? Doesn't make any fucking sense. And to be fair, there's a lot of stuff, again, I hate to say that Wes is completely correct about in what he's speaking, and the higher pay is going to be required to ensure people don't just leave to work at Amazon. But unless you tell us what that pay is, or give a rough idea of what kind of ballpark figure you're thinking about those nurses' wages, everything's still up in the air, and you're not challenging the government on their failure to be able to implement that pay packet unless you give us that number. You say we would get into negotiations. Well, if your negotiations are just 8.5% or whatever it is, or because it's just above what the independent pay review body, then you're not doing enough to deal with the issues that you're telling us is such a problem in a meaningful way that's actually going to address it. Like, it doesn't make any sense. And again, you're not going to be in power for 2 years, so you have every opportunity and ability to be able to make completely baseless promises that just push the government on policy. Like, I don't know what they're trying to play at here.
10,000 more nurses and midwifery clinical training places, and crucially, as part of the whole package, doubling the number of district nurses qualifying, because if we can have more care in the community, we can both support people to be discharged from hospital safely back to their homes, but if you've got district nursing in place, we can even prevent people from having falls, becoming unwell and walking through the front door of the A&E, because all of these problems are linked, and we've heard that this evening. The front door to the NHS is broken in primary care, the exit door to the hospital is broken in social care, and unless we deal with the front door and the exit door, hospitals are going to continue to be clogged up.
Why doesn't he say this shit when he's being interviewed on LBC and like on Sky News? Why is his first port of call whenever he's on like the actual major news networks is to say, you know who I really hate? The BMA for calling me out on my shit about private healthcare. Like, why? Like, why does he keep saying nonsense on the news channels rather than saying the empirically correct things that he's saying here? Obviously, he needs to say it better with more optically beneficial statements around pay and be more definitive and challenge the government better on these kind of things. Yet he just goes on other news programs or spend his entire time saying, "Oh, well, the issue with the NHS is that it's run for doctors and not patients," which is just categorically untrue, and make himself an enemy of the medical staff in this country. What the fuck is he playing at? What does he think he's even doing?
In the way that we've heard this evening.
Let's just work out what the problem is with workforce and care. We've got some carers with us. Ali Gujdi, you're a carer. I mean, is it an attractive job?
It's very rewarding, but I believe the government doesn't have a clue what a normal care worker goes through in a day, the amount of responsibility they have, and the amount of
Of course, them don't. They've all lived fucking silver spoon, gone to private school, gone to Oxford, studied PPE, and then been a lobbyist, a journalist, or or a management consultant. In the case of Miss Secretary of State over there, they've never worked a real job and they don't understand what a real job is like. So yeah, of course they don't know what the hell they're talking about.
pay they get paid is absolutely ridiculous. I think they are very undervalued. I've got care workers that tell me they can't even keep the house warm because of the living crisis and how much underpaid they are. And I'm quite lucky enough working in a company that is employee-owned business, so we do get a bit of a share, but the company as a whole is not getting that support from the government.
Tony, do you want to add to your experience? Yeah, behind you.
Oh, hi, Sharon Lowry from Be Caring. We recruit and train hundreds of care workers every year. 50% of those care workers leave within the first year because we simply cannot give them the proper and fair terms and conditions that they deserve. So they're passionate, they care about the job, but they just can't stay. We've got to fix that, and it's not short term.
And again, another thing that I'm going to have to give credence to the words of someone I actively despise. And Anna Soubry was correct on Question Time, right? If you are a conservative and you fully believe in the primacy of market dynamics, the market of the labour market of the healthcare industry is telling you you're doing a bad job because your pay is not good enough to attract or retain the staff that you need to be able to fill those positions, right? If the demand for something, if the supply for something is short, for example, you're going to have to be able to increase the remuneration that you're going to be able to pay for that to be able to increase that supply. It's really simple market dynamics that they just seem to have completely forgotten. And again, as I've said many times, their ideological commitment to move as much of the NHS workforce into the private sector as possible by negating their terms and conditions in the actual public sector to then justify further privatisation on ideological grounds at the expense of the country. And it's very cynical.
Funding. Yeah. We need, where is this money? Where is this long-term funding that's coming to providers that allows us to value the workforce?
Matthew Taylor, you started this conversation. What's the answer? What do you want the government to do?
Well, I'd like to see the industrial action addressed urgently because it's making a difficult situation even worse. But the government has finally promised a workforce plan. We've been asking for it for years. We need that plan, and we need it to be a plan which starts to make an impact quickly. We do have to address the issue of social care. It's not just that when you have patients in hospital they get deconditioned, is the phrase. They become sick, they become more dependent. But it's the most expensive place to have people. Nursing homes are less expensive than hospitals, and care at home is the best option often for families. So, what we have to try to do is to shift the way that we provide care. And actually, the leaders I speak to want to do that. They want to see more money moved from the acute sector into prevention, into primary care, into community. But to achieve that kind of shift, you've got to have capacity and you've got to have headspace. And at the moment, we have neither.
Helen Whately, you're the Minister for Social Care. You heard a carer there saying you don't have a clue as far as he's concerned.
Well, actually, it was just a couple of weeks ago I was out doing visits with a care worker, and actually I know what...
You say that, yet I've stood next to the proles. I understand exactly what they're going through. Thank you very much, Mr. Carer.
Fantastic job it is that care workers do, whether it's those who are looking after people in their own homes, which can be really tough but also really rewarding, and of course those working in care homes and nursing homes and all the other forms of social care. And so I do know about that, and I actually do really want to make sure that our care workers get the recognition that they deserve, the status of recognition for their skills, and of course that recognition in pay and terms and conditions. Now, I heard one of our audience members talking about the importance not just about the short term, but also for the longer term. So that's why in the autumn statement, £7.5 billion, a record level of increased spending, was announced for social care to get up to that amount over the next 2 years.
Record spending means nothing when inflation is high. The money is still worth less. And also, you have to look at the spending as a percentage of GDP. Now, to be fair, I haven't actually looked at the numbers specifically for funding in social care. So I cannot confirm nor quash what she's saying. But that is absolutely in the case in the NHS specifically. The funding has not gone up in terms of GDP. It has decreased consistently since 2010. And, inflation means that the money is, of course, overall worth less than it was over that time. So record funding as a phrase means absolutely nothing. It's completely meaningless phrase.
2 years, up to £7.5 billion more for social care. So that's really, really important to go into increasing the amount of social care that's there, but also doing things like making sure that care workers, I want to see care workers get better terms and conditions for things like the amount of care to be booked in advance so that there's enough of it and so workers would in turn know what work they're going to get down the line. We're also working really hard on social care recruitment and to get more care workers into the workforce. We've got a national government recruitment campaign to encourage people to work in social care. And in the
exactly, record in no way means sufficient. Exactly, 100% Jim Speak.
Spring, we're going to be saying more about some of our social care reforms, which is particularly for the workforce, and making the career in social care a more rewarding career with clear career progression, because that's something I often hear. It's not just about the level of pay when you start working in social care.
Okay, well, what else could be
what's really
improved
important is
if we want
for your
to fix
skills to be recognised as you grow in experience and skills and to have a career path.
All right, thanks, Helen. I'm sorry about the delays. A little confusing for everyone at both ends. But what else could be improved if we want to fix the NHS? How about productivity, which keeps being talked about by politicians in particular?
I'm enjoying the drum kit in the background here. It's really adding to the atmosphere of this debate.
Zaranko from the Institute for Fiscal Studies. The NHS, as ministers keep telling us, does have more money, it does have more doctors, but it's doing less. Can you explain what's going on?
There is no single, simple explanation for this, but at the national level, the data suggests a few things. First, as we've heard about already, is the challenges hospitals are facing getting people out. There are lots of beds that are full of people who don't need to be in hospital anymore, and that is beds that can't be used for other things. We also need to remember that there are lots of beds full of people with COVID-19. That, on top of a major flu pandemic, again, is more beds that can't be used for treating people with other conditions. You've then got issues around perhaps staff burnout and morale. You've got issues around infection control measures potentially impeding staff's ability to get around and treat as many patients as they might usually have done. And all that's adding up to a
Hemaraxo with a follow. Welcome to the Justice Stream. Hope you're doing well.
System that's struggling.
But does the overall data suggest that doctors are doing less now than they were before? They're treating fewer patients?
It's not that simple. The NHS is treating fewer patients, but those patients might have greater care needs, so it might require more resources to treat them. It may be that we're treating lots of COVID patients, which means we're less able to treat people from the waiting list, for example. So it's not that they're doing less, it's that the NHS is managing less of the usual business-as-usual type care.
I mean, we're treating, both you and the government are saying you want more from the doctors, aren't you?
Well, GPs tell me that they are doing 1 million more appointments now than they were before the pandemic. There aren't more GPs. In fact, there are 5,000 fewer than there were 10 years ago. It's partly the challenge we've already heard about the complexity of the issues and the fact the system is broken. But this, for me, comes back to the central argument that Labour's making, which is, of course, more investment's needed. We've had more than a decade of underinvestment. But it's also about reform and the way that the whole system works. Because if you compare Britain to other leading economies and you look at where the money goes, when it comes to investment in hospitals, we're running near the top of the table pretty much. But then you look at primary care, community services, mental health, diagnostics, capital spending. We're either near the bottom, at the bottom, or seriously lagging behind. And that's why we end up in this absurd position where instead of going to see a GP, which would cost about 40 quid on average to see a GP, patients can't get to see their GP, so they end up in A&E, which can cost around £360. So, yes, investment's needed, but we've also got to look really carefully at where the money comes from. And Labour's committed to more investment. That's why we've said to fund our workforce expansion, we would abolish the non-dom tax status, because people who live here and make Britain their home should pay their taxes here. But we've also got to look at where the money goes and make sure that for every penny that goes into the NHS, that money is spent to best possible effect.
Can I bring it to the Lane?
Yeah, I mean, you say this now, Wes, but you're the one advocating for more spending on increasing private healthcare provision in the NHS, which isn't value for money. It is explicitly, definitionally not value for money, because you have to pay for the overheads, you have to pay for the labour costs, and then you also have to pay for the profits of the contractor. It is de facto inefficient, especially in a service which you are running entirely at free of the point of use, because there's no market feedback for the company involved. So they can run a slapdash service as much as they want, because they're not subject to market dynamics to be able to deliver proper end product for the person who's actually using the service and the end user of the service, right? It's nonsensical, completely nonsensical, indeed. What I really wanted to do was get the audio of Jean-Luc Picard saying "Shut up, Wesley," and have it as one of the things that you can use your channel points on, as like an alert. But unfortunately, I haven't got a clue what I'm doing with Streamlabs. So I don't know how to get it to work. So I'm gonna have to look that up. Although I am a fan of the new sound that I've got for follows and subs, the Ash Sarkar, Piers Morgan thing, which I think is quite funny.
From the Royal Society of Medicine. I mean, is there a productivity problem with doctors? You know, are consultants spending too much time doing private practice or teaching, or, you know, are they spending as much time as they can doing the work that would clear the backlogs?
Doctors are all working extremely hard. The Royal Society of Medicine's multi-specialty, and all of my colleagues are telling me about how extremely busy they are and that they don't recognise the service they're now working in. What does worry me is that doctors are retiring really early. It used to be said that doctors were like sharks. They just kept going, but that's not the case now. I don't know whether it's the working conditions, I don't know whether it's pension issues, I don't know why, but doctors are leaving and retiring, and I would definitely consider that in terms of making change and encouraging doctors to stay in the workforce.
There is a very complex pensions issue, which we were going to, but do you have an answer to it?
Well, I think the government addressed this during the pandemic to keep doctors in. They know what the answer is. They've just got to get on with it.
Which is what?
Well, you basically need to remove the financial penalty that sees doctors retiring early for no other reason. They pay a financial penalty for working as long as they want to.
Helen Wait,
they've just got to fix this problem.
Helen Wait.
So what we recently announced was what's called increasing pension.
Big fan of Rawls, actually. I think Rawls is one of the only liberal kind of philosophers who actually see a lot of... I mean, I guess he's probably an Enlightenment thinker, really, but like, or at least, you know, in that kind of line of thought, right? But I think a lot of Rawlsian liberalism speaks a lot to the kind of ways in which that I would view how we should think about society. In a way that what you'd get from kind of like Locke or Hobbes, I find incredibly irritating on that within that regard. Rawls is good, actually. I'll definitely have to check out that Radio 4 segment, Scribby. Thank you for the recommendation.
Flexibilities to try and address. Oh,
sorry, go on.
Sorry, the delay really caught me there. So yes, absolutely, to address that. And one of the things we also are working on as part of our long-term plan for the NHS workforce, so that we make sure that we're looking 10 years ahead to have the workforce we need in the country, is as part of that, looking at this thing of making sure that people work all the way through their careers and having the right kind of flexibilities in the way people want to spend their time. Because absolutely, the workforce is at the heart of the challenges for our health and social care system, the workforce in healthcare and, of course, the workforce in social care.
Vasily Crispy, you're a junior doctor. You want to come in?
Yes, I am. I'm also the co-chair of our PMA Junior Doctors Committee here in Yorkshire. What we really need to address is also the day-to-day work that we do as junior doctors, and as part of the backbone of the NHS, we deliver the day-to-day care for patients. And we simply cannot deliver any more than we already are, because we're stretched, we're physically and mentally drained from the work we're already doing. We're firefighting to keep patients alive day and night. The reality is, as a junior doctor, newly qualified or well into your career, you'll be looking after an average of 100, 120 patients at any given point. If any of them become unwell, you simply do not have the capacity to care for everyone else. We're firefighting the care of patients. We're not delivering the standards that we want because we simply don't have enough colleagues around. The pay cuts that we have suffered have led to bleeding our profession out with 9,000 doctor shortages just in England alone.
And do you believe you're going on strike?
Yes, absolutely.
You're balloting at the moment, aren't you?
Absolutely.
And you will be going on strike.
I will do, because this is the answer to retain our colleagues. We shouldn't be talking about recruitment if we can't retain our colleagues within the profession. We're leaving to...
Oh God, and that's the thing, is that the unions continually hammer home this point, right? It's not about their own pay packets. It's not about how much remuneration they get. It's that these are the people who actually understand the health service in a way that the politicians who just coast into their jobs off the back of their lives in private school and their lives going to Oxford, right? And they get into a position of political power and they don't understand the issues of the institutions they're supposed to take care of and supposed to budget for. Yet the doctors and nurses who are the ones balloting for strike action, who will be going on strike, are the ones who are coming out here and saying, no, the future of the NHS depends on pay rises, because it's not just about how much money we get at the back end. This issue is an issue of retention and an issue of recruitment. And the ability for us to do our job is actually far less dependent on our financial remuneration and far more dependent on the actual conditions that when we go to work. And if we go to work and we have to deal with far more patients because there's not the staffing capacity to be able to deal with the workload, then we need to recruit more people. And we can't recruit more people if there's not the financial incentive to do so. They understand this shit, and the government hasn't got a fucking clue. They just don't.
Other countries and other industries in the first place. We're all in here because we care about our patients, because we care about our profession. But if we're being brought to the point where we simply do not have any other choice, we must strike, we must take industrial action. The door will always be open for all trade unions to meet at the table, but we're simply asking the government to come and meet with us because we desperately want to save our profession and the NHS.
Elise Charlesworth, you've got your hand up from the Health Foundation, yeah.
So I think it's really important to understand how critical that capacity issue is, not just for quality of care, but also for productivity. So all the evidence is that rather like motorways. You know, if a motorway is really full, one small shunt leads to massive and disproportionate tailbacks. Hospitals are the same. The evidence is that if you want your hospital to run smoothly and effectively, you need its occupancy at between 85 and 90%. We're running at over 95%. You also need to invest in things like modernising computer systems, in dealing with the backlog maintenance so we don't have theatre sessions cancelled because the equipment's not working. So actually, capital investment, the failure to invest for a decade in building the capacity and modernising that capacity means that staff are working hard, incredibly hard to compensate, but they're being constrained to work ineffectively.
Thank you. Well,
and it's points like that that completely destroy the narrative that you get from idiots on social media who, again, don't have a clue what they're talking about because they've been trained not to have a clue what they're talking about, because the entirety of their worldview and their ability to be able to understand these problems is shaped through the media narratives that are drawn by people who have a vested interest in obfuscating this issue because they have private healthcare investments, like, for example, places like GB News, who do all this stuff about the NHS being not fit for purpose. When that points like that very, very explicitly underline why a lack of investment is a problem, why continual adherence to market dynamics and privatization is a problem, right? If you are fully market-brained, you believe in this, like you believe in the idea of running at maximum efficiency without contingency, right? That's what led essentially to a lot of the backlogs of shipping during the COVID-19 pandemic, because all of our shipping lanes were all running at maximum efficiency but without any contingency. So as soon as there was a backup, it had a massive effect on the rest of the supply chain. And she's right, with the tailback analogy on the motorway, it's identical in the NHS, in that the underfunding, in even the comparative good years, which weren't actually good, but, let's assume that they're the better years. The lack of funding in the better years means that when we get to the position where we need the extra capacity to deal with the pandemic, the problems compounded and they can't be fixed without a gigantic amount of investment. And again, we can do that investment because we have this amazing thing called the fucking central bank. We have control of the money supply. You can put as much money into it as you bloody well want. You don't have to use PFIs. This is a complete Hobson's choice that we're being sold here.
Quite a lot of suggestions have come down to getting more money into the NHS, and our opinion poll touched on a number of ideas. When asked if people who miss their appointments should be charged, something floated by Rishi Sunak in the Tory leadership campaign, 70% agreed and only 22% opposed the idea. When asked if people who earn large salaries should be charged for non-emergency care, suggested by Ken Clarke, a former Health Secretary, 48% agreed and 41% were opposed. We asked if people should pay higher taxes to fund the NHS, something Rishi Sunak did briefly introduce, only to be abolished by Liz Truss. 43% supported the idea, but 46% opposed higher taxes. And we asked whether people would prefer to move to a subsidised social insurance model. Just 16% supported the idea and 63% opposed it. Helen Whately, can I ask you to...
Well, I'm glad, the media propaganda is not working for the vast majority of the population, which is helpful. But even so, the fact that it's as high as 16% is quite frankly astounding to me.
On to those polling numbers, do you think...
But again, just making people who have high salaries pay for their non-emergency care does nothing. It's an absolute it's an absolute, you drop in the ocean of the amount of care that the NHS does, and of the population, right? 100k, that's like, what, the top 4th percentile of the country who earn more than 100k? That's basically nobody. That's not changing, that's not going to have any meaningful impact on capacity in the health service. And if they're using these services, even if they are non-emergency, if they're the kind of things that you can use in private care for, the vast majority of people, even who earn that much money, probably can't afford it anyway, if it's something that is going to require skipping the queue to be able to access private healthcare. And if it's something incredibly serious, it's going to be referred back to use NHS provision regardless. So it doesn't change the issue of whether or not the NHS has the capacity, because it's just going to get referred back to the NHS regardless. Yeah, that is an absolute non-starter, which, again, just fundamentally doesn't understand the model of healthcare that we have in this country.
Charging, either for missed appointments or for people at higher income levels for appointments, is something a Conservative government might consider?
So we're committed to an NHS that is free at the point of need. That's a really important principle of our National Health Service. The important thing alongside that is, of course, that we put the investment into it and we have an economy that can afford that. So growth and a stable economy is really, really important. We are increasing the funding into the NHS. There's an extra 3.3 billion going in over each of the next 2 years. As I said, social care getting up to another 7.5 billion, because that's really important looking at...
Yeah, as I've said previously, as soon as the election year comes, you've then promised budget cuts to be able to quote-unquote balance the books as soon as the next government comes in.
Health and social care, so together that's around £14 billion. And actually by 2025, our funding of the NHS will come up to £166 billion nearly. So that is really a huge amount of funding going into the NHS, very importantly to pay for things like more doctors and nurses and other healthcare staff.
I mean, these numbers sound big, but Ben Zaranko, how big are they compared to our European and American friends?
If we compare to the usual countries that the UK likes to compare itself against, countries like Germany, France, the Netherlands perhaps, we spend a little bit less than they do as a fraction of national income on health. We spend a bit more than more southern European countries like Spain and Italy, but the UK is more or less in the middle of the pack. But one issue with that is that lots of those countries in Europe are also richer than we are. So the same fraction of national income actually can buy you more healthcare. So one of the underlying issues with all of this, around the pay dispute, around NHS funding, is the weakness of our overall economy and economic performance, and that really needs to be addressed alongside all of this.
West Street people don't want...
I wonder who's to blame for the poor economic performance of the country. Is that 13 years of mismanagement by the Conservative Party under a failed economic order that has no proper justification for its continued implementation in this country? A failed neoliberal policy that has bankrupted our economy in the wake of a global financial crisis during a recession where the one thing you're supposed to do during a recession is use fiscal stimulus to make sure that you have an economy that still functions on the demand end. And then implementing austerity, contrary to every single reasonable economist in this country, that then slashed our overall economic growth for the course of this period, basically eviscerated the wage packets of the working people in this country over the course of that period. This is catastrophic economic mismanagement from the Conservative Party, and not, as people keep saying, of during the pandemic or Boris Johnson or anything like that. No, this is Cameron and Osborne, is the Prime Minister and Chancellor of 8 to 13 years ago, who are to blame for all of this, because they have their mismanagement of our economy post-financial crisis, because austerity was a political choice done incredibly cynically. Up to 330,000 people died because of austerity. More people are dying now because of the failure to invest properly in our NHS. It's like they only have themselves to blame, and the fact that the brown-nosing, private school-educated, Oxford-attending, incestuous media political establishment of this country, the carousel of journalist to lobbyist to politician to think tanker that continually infects our political discourse, has told us that this is economically sound when it demonstrably is not, is quite frankly to blame for 6 figures worth of avoidable deaths. That is the reality of this country, and again, I'm just fucking sick of it. And obviously, and I keep saying it. I keep saying it, but I cannot stop saying it, because it's important to say. And yeah, Amity, you're absolutely correct. Like, the additional funding that they're putting in is very, very shallow. The overall NHS budget is £168 billion, so £2.3 billion is nothing. Ace of Skate, thank you for the follow. Welcome to the Justice stream. Yeah, when you think we got run 11 point consumer price index inflation, I guess consumer. Is it CPI or RPI that's relevant? I don't care, but inflation is at the 10-11% mark. But even if we say that, because if you win services, inflation is about 5% currently. When you take inflation into account, the previous £168 billion budget is now worth less, even with that 2.3 billion added, because the actual currency is worth less due to inflation, plus the fact that GDP has grown within that time. So as a percentage of GDP, it's even decreased. So you're absolutely Christ, Amity. It's just it's not even a drop in the ocean. It is still a drop in funding from what it should be, because obviously of inflation and because of the increase in GDP. I mean, To be fair, this one isn't even a mainstream media issue. This is just politicians. I mean, I guess it is a mainstream media issue because the politicians don't actually call them out on the media journalists don't call them out on this stuff because they're all bootlickers of the establishment, as we know. In the fact that they're all mates who went to the same schools, went to the same universities, who all work at Westminster, who all continually work for the same people in this kind of weird rotisserie that they've got going on. That they won't properly contextualize these things. As I said previously on the stream, the facts don't lie, but people lie with facts all the time, and that's what they're doing. They're taking the fact that the overall nominal budget has increased, but refusing to discuss actually what it is in real terms and actually what it is as a percentage of GDP.
Higher taxes to pay for the health service.
I'm not surprised that we've got the highest tax take in 70 years.
So how are you going to up the funding?
So, look, we're not going to go down the social...
And again, as I continually say on this channel, but again, it is still continually worth me pointing this out. Back when we had a proper social democratic post-war consensus, there was another avenue for our government to make money. Our government made money because it owned these things called state-owned enterprises, which meant that, as well as taxation income that was used to be able to draw money into the exchequer, there was also money coming into the exchequer from their shares that they had in state-owned enterprises, whether they were entirely state-owned or majority share ownership, right? That's the thing that we used to have. We used to have British Rail. We used to have British Airways. We used to have British Petroleum. We used to have all of these in British Telecom. We used to have all of these things, and these generated revenue for the exchequer. When these things were sold off, the money for all of our public services had to come from taxation. That's the reason why our tax burden is so high, because the government has nowhere else to get it from, and both parties are of the opinion that no, there shouldn't be any state-owned enterprises because they are both neoliberal parties. This is the nonsensical thing. That's to be fair, that is true. ASOS case, British Rail was losing money, but now instead of losing money by having a deficit in the budget on British Rail as a service, we now have shareholders taking money out of the rail network whilst being subsidised by the government more than the rate that they were losing money on British Rail. So even though it's not profitable, it's still more expensive for the exchequer than it was when it was a state-owned enterprise. Do you see what I mean? But even so, obviously, things like British Petroleum were incredibly profitable. And that being privatised was completely nonsensical. Because you look at what's happened with North Sea oil as a case study, right? We privatised our North Sea oil and saw basically none of the proceeds once it ran out. We used it to fund some dole money in the 80s, and then the rest of it just got lost into the coffers of the private shareholders that then stashed over in, I don't know, fucking the Cayman Islands or some shit. And in Norway, this Equinor, which is 70% owned by the state of Norway, takes huge amounts of dividends out of the oil revenues in the North and Barents Seas, and then puts that into a sovereign wealth fund. So they have a continual budget surplus. Like, it's so obvious, right? And they say, oh, why are taxes so high? That's why your taxes are so high. Your taxes are so high because everyone in the country expects a minimum level of public services. We all expect it. Boomers have grown up with it, and we as millennials, even though, we've seen it crumbling before our very eyes, we understand that a properly functioning society should have these good public services. But it's very difficult to fund those public services with low taxation if your government has no other revenues. This is the simple fact. And that's why we should nationalise this shit. Or why we should never, ever, ever have sold private licenses to the oil fields in the North Sea. We should have drilled it with a state-owned enterprise, or at least a majority state-owned enterprise, for example, like Equinor.
Insurance route. When I had kidney cancer last year, beyond the brilliant people who looked after me, the best thing was that I didn't have to worry about the bill. So I'm not going to go down this route of social insurance or indeed user charging. The worst thing we could do to general practice by now is make GPs start dishing out fines to patients. Costly, bureaucratic, they've got enough on their plate. But when it comes to funding the NHS, I think the equitable principle, funded through taxation, is the right one, but where we've sought to do more in terms of our mental health pledge to put community mental health hubs in place, or our biggest expansion of the NHS workforce in history, we are asking wealthier people to contribute more by abolishing the non-dom tax status, which I mentioned, but also the carried profits loophole, which is something...
I mean, to be fair, abolishing the non-dom tax status and equalising dividends and capital gains tax, this isn't asking the rich to pay more. This is asking to rich to actually start fucking paying. Right? Let's be real on the phrasing of this. Currently, actual workers who expend their labour and sell their labour to the bourgeois, essentially, the proletariat, the working people of this country, they pay more as marginal tax rates than people who literally sit around on their ass making money from capital gains and from their share share dividends. Right? We get taxed more. Right? Someone earning fucking £20,000 a year. As an actual salary to being productive and contributing and creating the wealth that the society has to offer, pays a higher marginal tax rate than someone earning £20,000 entirety from shareholder dividends. Well, this country, that as a tax policy is nonsensical, because you're using your tax policy to disincentivize people from being productive. Even though it's wrong on a moral level, like on a moral level, it hurts my soul that's the existence. Even from a pragmatic position on creating economic growth by increasing overall productivity in your country, you tax things to disincentivize them, and you're currently disincentivizing people from from engaging in productive labor to try and to incentivize them to be in a position where they don't contribute anything at all to society and just sit making money off the fact that they have existing money. It's a completely ridiculous way of running a country. Completely ridiculous. Yeah, very true, Amity.
That benefits private equity fund managers, that money would go into mental health. So we can find wealth to put into the NHS, but let me tell you.
I mean, if what's happening to the class divide in the countries continues the way we are, I mean, there's only two options, isn't it? The socialism or barbarism. And the Liberals who supported this shit, remember, Liberals all voted for David Cameron. They all voted for austerity. They all voted for the destruction of our public services, the destruction of our institutions, the destruction of the social contract. All the Liberals all continually vote for this shit. It's only since their mortgage payments started increasing under Liz Truss that they ever thought about moving away. They got scared off by the scary jam man in 2017 and 2019, for example. And they're now going, oh, hang on a minute, where did all this barbarism come from? And I'm just like, yeah, it's your fault. You got what you wanted. Simple.
Why the last Labour government could invest more than the Conservatives, because we got growth into the economy and we were able to invest in higher pay.
No, it's because you had private finance initiatives. I mean, to be fair, growth was higher, but the growth was off the fumes of a financial sector that had been over-leveraged and was a continual ticking time bomb that was bound to blow up. And as I said, the issue is that was that it was a house of cards that got dumped on future generations. Simple as that. Simple as that. It was completely unsustainable.
To public services without hiking up taxes. And unless we get the economy growing, we are going to continue in this terrible doom spiral 13 years of Conservative government have locked us into.
Right, what we haven't spent a lot of time talking about is GP care, and we've got some GPs in the audience. Shula Imtiaz, where are you? Shula, what's your experience?
The experience is that general practice is incredibly challenging at the moment. I work in an inner-city practice. We're facing the cost of living crisis biting on the forefront of our patients. They cannot afford heating. They cannot afford to eat. They are coming in more unwell because they're malnourished. We then have the added challenge of the frustration of patients. We have over 7 million patients on a waiting list to be seen by a specialist. They have no way of accessing that care and then come to general practice to meet that demand. That's further fueling the frustration and anger that we sometimes or often are now facing in general practice.
Let me bring in Philip Bamfield from the BMA, because there seems to be an argument going on between...
Philip Bamford is an absolute giga-chad, so I'm looking forward to what he says.
BMA GPs and Wes Streeting about his proposed reforms. What is it you object to about what Labour want to do?
There seems to be a fundamental misunderstanding about how effective general practice is. They are one of the most effective and efficient parts of the NHS. They see huge numbers of patients. They are the consummate experts at managing risk in a way that is completely unbelievable, the number of decisions they have to make day in and day out. And if you remove their ability to treat, then the entire workload shifts into secondary care. So the idea of self-referring to a hospital because you think you might have had some internal bleeding, as Keir Starmer has suggested, is just a non-starter.
What about making GPs or all GPs NHS employees. What's wrong with that?
Well, that has an enormous cost to it because they are efficient and effective at what they do. If you look at primary care, in terms of the care that it delivers, it is giving value for money. As soon as you go into secondary care, the administrative and management of that is overly complex. So it would be complete false economy to do that.
West Streeting?
Yes, let me take those issues in turn. I absolutely value the role that GPs play, and that's why Labour's committed to recruiting more GPs. But I recognise that there are severe workload pressures as well. And where we can, in what I think will be a fairly limited number of cases, enable patients to go directly to services like they do in physiotherapy now, for example, we can get patients treated faster, GPs workload down, and better value for money for the taxpayer. Take ophthalmology, for example. I could go and see my optician. They could look into my eye and say I need to see an eye specialist. But before I go to the eye specialist, I have to go back to the GP to say my optician said I need to see a specialist. That's a waste of time. Take gynecology. Women are waiting 7.5 years for an endometriosis diagnosis, which I think is an appalling situation, often going round and round in circles with their GP. Why not have gynecology one-stop shop set up in communities so that women can go and see some specialists about their conditions and get treated faster? And finally, on mental health, with the
I think that, again, it just sounds like a position that just hasn't been thought through. And he's just like, well, what if it's just where someone just goes, bureaucracy is bad, let's get rid of it, without properly understanding the consequences of what this actually represents, right? Like, I'm pretty sure that Wes Streeting just really doesn't know what is going on here. And he just said, well, I need to look like I'm trying to solve some issue, when he's not actually coming up with a proper solution. Again, whether it actually becomes law when they get into government, who even knows? Who even cares at this point? Because they basically, you can't trust a single word that this man says. Yeah, exactly. It sounds like something like a layman would continually would back, without properly understanding whether it's feasible, or any of the actual the finer details of how inputting such a plan would actually work in practice, which looks like a bit of a pipe dream. Notice how Streeting is not looking him straight in the eye when answering the question. True, Scribby, true.
Community mental health hubs that we would set up, that would take off a huge weight of pressure on GPs. That's not to say that GPs aren't expert. They are great investigators. They're great risk managers. I absolutely get that. That's why we want more GPs. But people are waiting, like 2 million people waiting more than a month to see a GP, 1 in 7 people not being able to get an appointment, a broken system that leads to people waiting on the phone at 8 o'clock in the morning to get an appointment and being told, we'll call you back to triage you sometime between 9 and 5, and if you pick up, great, and if you don't, we're going to put you down as a did not attend. This is the broken system, and I'm not blaming GPs for that, but we are thinking radically about how to fix it.
What tends to happen in those circumstances, you then clog up the system with the worried well, and the people who really need care then don't want to bother the service. And of course, we have an absolutely disgraceful widening of health and wealth inequalities in this country at the moment that is a political choice. There is a really interesting point in that what Wes has touched on is about eye care. And in Wales, for example, eye care is automatically referred from general practice to opticians without having to see GPs. And what the NHS is really bad at is taking things that work somewhere and scaling them up and rolling them out.
Just briefly, John Cosgrove, you're a private GP. Is private the answer?
Well, I was a full-time NHS GP for 16 years, and as my colleague was saying just now, I've never seen so much frustration in general practice, both by GPs and their patients. The difficulty with actually getting to see a GP, is what friends and family tell me, is just maddening for both sides. General practice has done really well to provide really speedy access for people throughout the COVID pandemic and so on, through telephone and electronic consulting and whatever, but they cannot also provide the face-to-face human contact that is so vital and that people are so hungry for, and that's exactly why I've set up a private clinic, to provide that service. And I fear that might be part of the solution for those who have the ability to pay.
Well, Helen Whately, when you listen to this, there are, of course, lots of people who think that actually this was your plan all along, to run the health service into such a desperate strait that people would have no choice but to go private.
So, I mean, like, Krishna Gurmurthy, he actually asks the questions that other journalists just don't bother asking. As in, only get it on Channel 4, don't you?
What's your answer to them?
Oh, that's completely untrue. But it's a really good conversation that you've been having in the studio there about GPs. And I want to say, GPs are a really, really important part of our health system.
That's an interesting avoidance of the actual question. Oh, that's just completely untrue. Anyway, about the other question that you asked.
They have fantastic skills, those all-round generous skills to be able to look after.
As we all know secretly, it absolutely is true.
The whole patient. There's a huge amount of demand on GPs at the moment. GPs are doing 80,000 more appointments every working day at the moment compared to before the pandemic, to give you a sense of that extra workload. We've got 2,000 more GPs over the last couple of years. That's around 21,000 more staff working in GP surgeries, bringing other skills. And actually, this is really part of the answer to getting primary care to work. I don't think we need to do that big top-down, see-from-space, expensive reorganisation that Labour are suggesting, which I've heard could cost around £7 billion.
You're literally the party of expensive reorganisations. Like, I think both reorganisations are silly. I think Wes Plan is nonsensical, and the Lansley reforms are incredibly damaging. Just like, why don't we just stop fiddling with the service and give it some fucking money?
£1 What we can do is work with the GPs to improve those services. For instance, involve pharmacists more, and indeed use technology to tackle that 8 a.m. scramble for appointments.
Just last word in 30 seconds to Matthew Taylor, because you're now representing NHS providers. You've been a policy chief in the past. When you listen to this conversation, are the politicians thinking big enough?
I think we do need a vision for where the health service could be in 5 or 10 years. And actually, we haven't talked at all really tonight about technology, innovation. You know, the role of GPs is going to change partly because we're going to have a diagnostic revolution. Our capacity to monitor our health and understand our health is going to change. We need a vision, and then we need an account of how we're going to get there. Because we have to be honest with the public. Given where we are, it is going to take time.
Yeah. Thank you all very much indeed. I'm really sorry, that's all we have time for this evening. Thank you to
It's not just going to take time, though. It's going to take money. It's important.
everyone who came here to St George's in Leeds. Thank you to Wes Streeting and Helen Waitley in London. We are back at 7 tomorrow night. Until then, that's Channel 4 News. Good evening.
Interesting debate, actually. Really good to get... Really interesting that actually for the first time when they properly have discussions with medical professionals, because they just show the politicians that they really don't know what they're talking about. I mean, I hate to say it, but Wes made some reasonable statements during that discussion. But then when you actually get to his plan, it's like incredibly half-baked, and the guy from the BMA, who he's basically at war with at the moment, very much shot him down at the time. But it's interesting just watching NHS staff just say, no, the answer that you keep saying about all these different tinkering things that you want to do, we just need money. We need money and we need staff and we want pay rises. Like, that's what will fix it. Because the model is sound. The model is absolutely sound. It doesn't need tinkering with. It just needs not underfunding and not and we need politicians who aren't going to go to war with this at the worst possible time as far as both parties are concerned. And yeah, they're just 100% correct. And it's really admirable that they were doing it to try and save the service itself rather than just for some kind of personal gain, which is clear from the answers that were given, that they care deeply about both the health and social care services. But neither of the political parties treat this issue with the gravitas and seriousness that it deserves. Where we have one party just saying, "Oh, we're putting money in," when in real terms you're not actually putting money in, and we have the other party going, "Well, first of all, we're going to tear up the GP contract for no reason." Without giving a proper reason either. And on the other hand, we're going to ensure that people can self-refer to gastroenterologists for swallowing their AirPods. Like, that's the position that we're in now with the political discussion around the NHS. And I'm pretty sure that Wes and Keith don't actually really believe in these nonsense policies they're stringing out. They just want to make it look like they're revolutionary with regards to the NHS. To satiate the press desire to see any discussion that isn't just, we want to spend more money on it, because they're not allowed to say that, because their media is run by people who think that more money equals bad, which is the worst possible position to be in as a country trying to save people from dying in its hospitals. So yeah, I'm gonna, as with always every segment I overdo, I'm gonna blame the media. And with that, I'm actually gonna shill in this end of this bit. If you enjoyed this segment, please like, comment, and subscribe. You can become a member for 99p. It's cheaper than a can of Red Stripe. And if you're still here on Twitch, please, if you're not following, I would love you to drop a follow. And if you are following, if you want to drop a subscription for $3.99, you get access to emotes, or you can subscribe for free with Twitch Prime. It's never ever expected, but always appreciated. And I will catch you on the next segment.